This video will give you a basic introduction to different types of dementia. Dementia is a general term that describes a condition that often affects memory, personality, and judgment. Dementia is caused by a disease or an injury to the brain and often gets worse over time. There are many different types of dementia, and for each type, there is a wide range of impairment. If you are concerned that someone you care for may have dementia, you should ask the patient's doctors two specific questions. First, what type of dementia is present? And second, how will this dementia progress over time? Part 1 of this video will discuss the different types of common dementias, and Part 2 will discuss how the disease may progress over time. Because there are so many different types of dementia, it may be important to know something about a few of the most common types. For example, Alzheimer's dementia is the most common type. It begins with short-term memory loss, such as forgetting recent conversations or trouble remembering names of new friends. It then progresses to long-term memory loss, with trouble remembering the date and year, or perhaps getting lost and confused in unfamiliar places. Often, Alzheimer's patients are not aware of their memory impairment, and it may be a family member or friend who points the problem out to the medical staff. Vascular dementia is another common type of dementia that can happen because of a decreased blood supply to the brain. This may be the result of a large stroke or a number of small strokes that happen over time. Sometimes small strokes are not noticed, and the patient or loved one is unaware of any changes in the patient's behavior. However, if a person has several small strokes over a period of time, their thinking, reasoning, or even mood may become impaired. Patients with Parkinson's disease may also experience dementia. Although not all patients with Parkinson's disease get dementia, some will. This type of dementia may include impaired thinking, memory loss, and sometimes hallucinations, which means seeing things that are not there. Lewy body dementia is another type of dementia that is related to Parkinson's. There may be periods of time when the patient is lucid and clear-headed, and then periods of time when the patient is confused or sleepy. Lewy body dementia may also cause hallucinations. Patients with this type of dementia sometimes move more slowly, and parts of their body may shake. Each type of dementia responds to medications differently, so it is important for the medical team to decide on the proper diagnosis. Here are some of the challenges doctors may have with making a correct diagnosis. The patient may suffer from more than one of the dementia types just described. Each type of the dementia may show up with symptoms that are unusual or not expected, and the patient may suffer from a type of dementia other than the ones mentioned here. Once the medical team has an understanding of the diagnosis or type of dementia present, this may lead to a better understanding of the prognosis or what to expect in the future. It may be helpful for you to ask the doctors, how will this dementia progress over time? Sadly, almost all types of dementia get worse over time. Some progress rapidly and some progress very slowly. For example, for most Alzheimer's patients, there is a very slow progression of memory loss that may not be noticed from day to day. However, when an Alzheimer's patient is moved to a new environment, there may be sudden confusion and agitation and an apparent worsening of the condition. Many dementia patients may lose interest in eating and drinking, but do not recognize that this is a problem. Also, some with very advanced dementia may lose their ability to swallow. If the patient cannot take food or liquids by mouth, one option is to put it directly into the patient's veins through a tube. However, such procedures can sometimes be uncomfortable or even harmful to the patient. Before such procedures are begun, you should discuss the potential risks and benefits with the patient's medical team. To summarize, if you are caring for someone with a diagnosis of dementia, there are two basic questions that you should ask the doctors. First, what is the exact type of dementia? And second, how will this dementia progress over time? Understanding the type of dementia may help when making decisions about treatment, and understanding the progression may help with preparing for care.